So I know there's different ones that you can inject, so what substance do you inject?
Basically just sugar, so dextrose, and then some kind of local anesthetics, either propane or lidocaine. So depending on if have you had any allergic reactions to either like Novocaine or lidocaine or anything like
They
that?
just don't work. They wear off 3 times as fast.
Okay.
So
Gotcha.
the dentist loads me with a special kind of Novocaine and twice as much as he would.
Okay, good to know. So that's that, and then a little bit of B12 too to help nerves heal.
Okay.
She may not need the lidocaine just like I didn't, so if that helps.
Well, we did put a little bit in there just to kind of like reset the pain neurons. So it's not
I would
necessarily
really
for the
appreciate
long-term
that.
numbing effect, but it's more for like resetting neurons that are kind of like entrapped by connective tissue that's tightened up, or scar tissue, or tight muscles and things like that.
And I'm on Lyrica,
Okay.
so I have a lot of peripheral neuropathy.
Okay.
So painkiller's cool.
Yeah, that's kind of the idea. So, can I get your first and last name for this?
Okay.
Okay.
So the theoretical purpose from what I read is to force the body to rebuild its collagen matrix. Is this correct?
That's the idea, yeah. So that's what the dextrose does. It sets up a secondary inflammation in the body to give those. So basically, the immune system comes when it's inflamed by the dextrose, cleans up any debris like cellular metabolites, extra scar tissue, things like that. And then it also draws fibroblasts to the area, which lay down new collagen to kind of strengthen the ligaments that we're working on. And then the local anesthetic resets the pain neurons that have been injured or damaged or entrapped by that dysfunctional joint tissue, if that makes sense.
So the reason that you can't take anti-inflammatory meds for 72 hours afterward?
Yeah. Mm-hmm.
Is that you're trying to get the secondary inflammation. That's kind of the point, to get the immune system to respond, right?
Exactly, yeah. So taking anti-inflammatory meds will just counteract the process. It just won't be as effective.
Including Voltaren gel, I was begging for it and James had to hide it from me.
What about narcotic pain medications that do not have, for instance, acetaminophen in them?
Acetaminophen's fine, because that kind of works on the central nervous system. Actually, no one really knows how acetaminophen works, but
no, it's weird.
right? But opiates are fine. Narcotics are fine, as long as you have a prescription. I mean, it's not going to counteract the effects, if that makes sense.
Okay, that was my concern. Is the Lyrica also fine, considering what it does?
I believe so.
Who knows what today is?
Should be the 11th.
Thank you.
Yeah, no, that's good. The Lyrica wouldn't affect it
Okay,
in a negative way.
cool.
So
So
you have
I
it.
think it would help out the lidocaine sort of deal.
Kind of work on a similar I guess. What's your birthday?
One.
Now resuming.
And then, what's a good zip code for you? Or what's your zip code?
85201. She lives with us now.
Okay. And then, it asked me, well, no, that's fine. Okay, so I need to ask you about the lidocaine, or like is sensitive to that. So no reactions in the past, like negatively, like allergic.
Nothing. I just need more of it to have it work. To reach therapeutic levels is difficult sometimes.
And have you ever fainted or anything when you've had needles, like drawing blood or acupuncture or anything like that?
I've learned to not watch. I am kind of scared of them. She's aware of this and is prepared to distract me if needed.
Okay. Gotcha.
That's why zebra battle buddies exist.
Okay. Do you have any history of, just a few questions, history of diabetes, kidney disease, cancer?
was surgically resolved completely, so
Okay. What kind? Do you mind if I ask?
cervical.
Okay. Um, and then any lung disease?
I just had asthma.
Okay. And then any autoimmune diseases? Like lupus or scleroderma, anything like that?
Not that
Rheumatoid
we're aware
arthritis?
of.
Alright.
I do have a history of severe allergic reactions, period, mast cell activation disorder.
Okay.
I have an EpiPen with me and a rescue inhaler for the asthma. And I do also have POTS, it's a form of dysautonomia.
Gotcha. Do you have any basal medication for asthma? Like
Singular.
Singular? Okay.
And Dulera also, actually.
Dulera. What's Dulera? Is it
It's like Advair, but it's a different steroid compound.
okay?
She's a pharmacy tech, so she's the person to ask.
Formoterol?
Yes.
Okay. Okay, good. Are you on any other meds besides Lyrica?
Yeah. I
Which
didn't
one?
realize I was gonna need to. I didn't realize I was gonna need to bring a list. So from what you've said, I don't think any of my other meds will react negatively. I'll definitely make sure you get a copy of the med list.
Okay, cool. Right on. Alright. Have you ever had any like X-rays or anything like for the structural issues?
Yes.
Okay, anything show up?
So T6 through S2, there is cartilage decay. It's accelerated, they don't know why. But they don't want to call it degenerative disc disease because of the EDS. T6 and up are good. We know from an MRI that L3, 4, and 5 and S1 and 2 have very minor form of spina bifida where they did not fully close in the front. And as a result of that malformation, I did have a traumatic spine injury, which resulted in the implantation of a spinal cord stimulator system.
She's a cyborg. I have a cyborg friend.
So that's in the implant, and so it's there.
Yeah, it's right here.
Okay. Wow.
I got it going right now.
So what does it do?
It lies to my brain about the pain signals from my legs. Instead of them feeling like they're on fire, they feel like, you know, when you cross your legs wrong and your leg falls asleep, right before it fully wakes up, it still pins and needly, but it's not painful anymore.
Mm-hmm.
Feels like that all the time.
Okay. Can we hold off on the injections? Do you have a record of this?
Of all that stuff?
Yeah.
You
Or at
need-
least reports. Like I don't really need to see the actual X-rays. I don't think.
Okay.
But at least if I'd like to have that just so I can make sure we're not doing anything that's like contraindicated or anything. Is that okay?
I think so. I mean, that's part of the reason why I'm only asking for shoulders down because I don't want to involve my spine unless I know for sure it's okay from my neurosurgeon. I have already asked him.
Right,
I was
okay.
waiting for the okay.
Okay, good.
And then my knees, my orthopedist went, yeah, fucking try it. Because he
Okay.
knows that I've got the knee of an 80-year-old on this side.
Okay, all right.
So
Okay.
I do have clearance for the knees, and I purposefully am avoiding spinal inclusion at this point. If it works, I'm going to call him back and be like, so I'm going to need that answer. But he's a busy guy.
Okay, fair enough.
Because he's good.
Yeah, it's because he's brilliant. So.
Okay, that's good. That's good to know. So do you have any allergies to meds?
Just aspirin, latex, and penicillin.
Okay. What's the reaction?
For the aspirin and the penicillin, I find it kind of hard to breathe. Nothing problematic, nothing even rescue inhaler level. And I get hives.
Okay.
And then for the latex, it's anaphylactic.
I have the EpiPen waiting to stab her at will if need be.
Okay.
Please don't make me stab her.
These are
That's
thick
your job.
pants. I'm
That
just
wouldn't be
saying,
ideal.
thick pants.
Yeah, leather's protected for that, right? For for that reason. Any allergies to foods or environmental stuff?
Cantaloupe, which is apparently common with people who have latex allergies, of all things. And most varieties of mushrooms, and also I am celiac.
You're kind of greedy with the diagnoses, eh?
You know what? Do you want to take half of them? Because I'm good with that.
No, that's. I'll just give you a hard time. So.
Hey, you asked for
Just
people
trying to-
that were broken, so you had puzzles to figure out and learn from. I'm
Yeah,
only
yeah.
giving you what you asked for, babe.
Fair enough.
I might have brought you the most broken one first. Sorry.
That's all. It's all good. Mushrooms.
The only other thing I was worried about that I have a question for you regarding,
Yeah.
I do have von Willebrand, so
Oh, okay.
I tend to bleed a little bit longer, and it doesn't look like normal blood. It looks like cartoon blood.
Okay.
It's like too red.
Gotcha.
So don't let that freak you out.
Okay.
And I have blood stop kits in case I need them.
Okay.
In my bag, so I'm prepared for that at the injection sites.
Gotcha. So we're not gonna use epinephrine to, because sometimes people use that to kind of like change blood flow. So it should be good.
Okay.
Yeah. All right. Do you mind if we do some muscle testing to kind of see what's
Do what you gotta do.
okay? What's the fun part?
Just let me know if you need me to take any of my devices or something off.
Okay. Where do you have those?
I took these off before, but so now I'm pretty much down to the fingers ones. They're
Okay.
not
But
rings.
they're not on. Okay. Gotcha.
They're the medical devices.
Okay. Let's check your shoulders first. Let's just use some muscle testing. Can I use your arm?
Mm-hmm.
So go ahead and push up. Let me know if there's any pain with any of this. Okay. Doing okay?
It's uncomfortable, but I mean, do it.
Okay. Just push it up.
See, when you're not touching your hair, it doesn't hurt there. That's weird. Yeah, it just gets uncomfortable. It's not really pain.
Let's switch it up.
Let's see.
Is that
This one's not fully in socket right now. There we go.
should we try again?
Oh, they're good.
That's good?
Mhm.
Alright, so I'm going to test through a few things. Just to kind of screen to see where. Do you mind taking this out? Just so we can access the.
I'm too punk rock.
Yeah.
Not even close, baby cakes.
It's up here.
Just one more. Oh, just with this.
Oh. It's odd.
Okay. So, any issues with digestion?
Yeah, if I don't take my Zantac, Zyrtec, and Ranitidine every day, it's anybody's guess on how long I'll be in the bathroom and why. And Cornwall.
Okay. And you're avoiding gluten as well as you
Oh
can?
yeah,
So like even like soaps and lip glosses and stuff like that?
I have to be really careful. There's
Okay.
no, I'm decked out right now. But
She actually makes her own makeup.
so,
Okay, good. Yeah, because I mean, otherwise why would your, because it seems like that your gut would be inflamed, I guess, if those meds are helping.
no, I'm pretty much, I'm actually really inflamed, like bloated right now, because I goofed up and accidentally ate gluten the day before yesterday.
Okay,
So I'll go back down a couple pant sizes, give it a couple days.
gotcha. So, but even when you're avoiding gluten, you're still better with the Zyrtec and Ranitidine?
Mm-hmm.
Any heartburn?
No, but I take omeprazole in the morning,
Okay,
like first thing, so.
gotcha. I'm just trying to think of why antihistamines would be helpful for your.
It's the MCAD.
Okay.
It stops me from being so very allergic to most of the world.
Yeah.